recording the idea of changing your intended outcome based on how you manipulate the soft tissue. So up until now, you've been playing around with your general protocol. And that's coming along, right, Luke? And then you've embedded the idea of joint movement and all that kind of stuff. People think of massage primarily as manipulation of the soft tissue. So they don't think about joints and bones as much, nor do they think about the fluid component of the body, or how the fluid moves around in the body. And they don't necessarily think about layers of structure. I put a Facebook post up yesterday. I thought it was pretty straightforward and simple, and it says, if you think you can palpate a single muscle, think again. And our education has been for massage so muscle-centric. The attention to learning all of the muscles and their attachment points, and takes up a ton of time in the classroom setting, because the concept is that it's going to be tested heavily on the NBLEX exam. And it is, because that's kind of the way people and educators in the past have thought about massage and what we target and what we benefit. But more recently, it has to do more with the nervous system. And then what's cascading, you do this, which triggers that, which results in this, which causes that, which is interpreted by this, and that's all on your sensory, information going into the central nervous system. And then it's interpreted, and then there's on your motor stuff, this is told to do this, which targets that, which talks to this, that ends up being a something, which we hope is the benefit that we're after. Person can move a little better or whatever. A lot of it is perception. A lot of it is, it feels different because something has just happened in the local area. So there's two premises that we want to pay attention to when we're looking at, how do we adjust pressure with all of our fun little props here in order to maybe have a little bit more influence on a physiological function. And this is right where you all are at. You've got the general platform, and you don't want to ever lose your full body approach. That is your main assessment. That's your main functional unit. That's going to actually result in most of your outcomes. But now that you know how to get around the body and bolster and all that, slight differences in pressure, which is going to go down, or shear drag, which is going to go across, and direction is going to make a difference in, am I affecting two layers that slide against each other, or am I trying to pump water in a tube, or am I attempting to create something that has gotten kind of stiff? It's called densification. That happens in the connective tissues, but you can't separate the connective tissues. They're embedded in everything. So even in a muscle structure where you can kind of see the striations and the reddish color and that sort of thing, it's still got this layer, this fiber is wrapped, and then this bundle of fibers is wrapped, and then, so you still have this material in there that can be more pliable or more stiff. And so how do we think about affecting that as we are moving through the general massage session? So now My philosophy on house cleaning is if I can't see it, it doesn't exist. But every once in a while, I have to find something that I've dropped behind something else, and then I'll see, oh, look, this happened and this happened. You know, there's that thing I've been looking for forever. And you typically don't always, in your general cleaning process, move the furniture back and then go, I'm gonna have to get the vacuum cleaner, I'm gonna have to do this, and then this, maybe this even needs a repair and all that. Usually in your general cleaning, the way you function in your general world is if you can keep things functional, even if it's not perfect, then most people are going to be all right. It's when the clutter or the something breaks, or there's a leak somewhere, or there's a crack somewhere, some creature puddles on the floor, or whatever it is, you have to narrow down what's going on. Most of the time, I'm assuming that you're not that different than me, that you don't feel like every week or every time you clean, you have to go through, move everything away from the wall, and repair all the cracks and all that kind of stuff. But once in a while you do. We just got done remodeling one of the apartments, and we had to it was one unexpected thing after another, and we ended up having to use a lot of force, a lot of effort to get rid of a cement floor kind of a thing and all of that. But we only had to do that. That was a really focused project that lasted for, I think it was a week we worked on that. And then we likely will never do that again. And a lot of focus with massage, people think they're doing something. They want to do that. They want to take somebody that is broken, or a function that is broken, and they want to, tear it all up and remodel it all and then refix it, and then go from there. But it doesn't happen that way. So we want to think about, how do we keep our room orderly enough, our body orderly enough, without causing a tremendous amount of suffering. Because if you're going to really shift and change, that is not always a pleasant situation, and you got to be in the right spot. You got to be able to focus totally on yourself and stuff, and the expectation that people can do that while trying to live their daily life is probably unrealistic. And you'll find it sometimes, there'll be some motivation to do that. But mostly when people come to see us, they want to be able to get through their daily life with the least amount of discomfort and complication. So massage is excellent at that. And it is one of the healthcare practices that allow for that. If you go to physical therapy, they're looking for what's broke and then what's going to reverse that. If you go to a nutritionist and have a nutritional evaluation, they're going to say, well, you can't do this anymore and you got to do this, and there's a big lifestyle change and all of that. If you're going to pick up on you've had a cardiac event and you're going to go through cardiac rehab and get used to a whole different way of being, because you are after something like that. Your body functions a little different. You're gonna, you have to focus just on that, and everything else around you has to take second place. Those are unusual sets of circumstances. So when we're thinking about the general massage protocol, I think of it as a weekly housekeeping situation for a client. Does anybody actually clean their house once a week? Do you really? That's good. And then every once in a while you'll get I know Sarah does this. she gets into a thing where she's got to do what's called a deep clean. You know, now you're not remodeling or anything, but you're moving everything and you're vacuuming into the corners, right?
The German Shepherd hair doesn't help.
Yes, extenuating circumstances.
It's a constant influence of stress on the system as a whole.
German Shepherd hair is going to push you. Yeah, either you're going to be able to ignore it like I can, or it's going to rise up to your consciousness enough that you can't not see it or can't not feel it, and then you have to do something about it.
Which can be very subjective. One person will be less bothered by what seemingly is the exact same thing. So like there can be a person with arthritis. They subjectively will not be as bothered by it as a person with the exact same degree. It really is very perception based.
And, you know, past experiences might influence that, you know, where somebody is more, they can't ignore, they can't look away, they can't get away from it. My granddaughter right now, although I haven't heard from her for a couple of days, she did something exercising, and there's a bundle of nerves that comes out of the cervical vertebrae down between the clavicle and the scapula, and then it feeds here into the front of the chest and into the arm, down to the fingers, and into that spot that people complain about here behind the shoulder blade. And that is called thoracic outlet. That's the thoracic outlet. It's the brachial nerve. So it's these nerves. There's a branch that goes here and one that goes here, one travels down here, and there's one that goes behind the back, which seems to be the one that bothers people the most. And people think it's in their shoulder, and it's not. It's something coming up from here, and she can't ignore it. It's, you know, especially in people that have nerve pain. Nerve pain is hard to ignore, and that's what this is. Now you might have some muscle changes around it trying to keep it still or get some more room, because the nerve plexus somewhere along the line, a piece of it is getting pinched, and nerves don't like that. Nerves want room, and they want it slippery so that they can slide. And so it's just, you know, it's driving her to distraction. That's all she can think about. This particular condition, thoracic outlet syndrome, is one you will see. Quite common, because it is quite common, and it shows up if there has been a shoulder injury where you've bumped a shoulder or you've moved your neck really funny, secondary to like a whiplash type injury. But it's also very common as people age, because they tend to come forward on themselves and that space in there gets reduced. And it's also very hard for it to resolve itself. It just lingers and drives people to distraction. Luke had this, and oh my goodness, it was secondary to when you broke your clavicle, correct?
No, it was secondary to working with, not doing massage with the athletes, but doing core exercises with them.
Oh, okay.
So, but the thing one I want to touch on is nerve pain, because nerve signaling is so essential for life, is one that everybody usually can't ignore. Nerve pain is one of those where the body is hardwired that if you don't have adequate nerve, conduction everywhere, it's a big, oh no, there's potential real harm here, as opposed to a bruise or something like that.
Yeah.
Right, or a scratch. You eventually can kind of get numb and forget about that. Nerve pain is hard to escape. But yeah, it was overuse, repetitive whipping a ball and having to retrieve and rebound.
That particular condition was actually what got me into massage back in my early 20s. And it was from changing my posture, hip up, down, and around, carrying babies on my hip. is what caused it. And I had a little daycare center at the time, so there was a lot of little, rugrats running around, and it persisted to the point that I was seeking out for chiropractic, and that didn't help very much. And then there was somebody that was popular at the time called Bonnie Pruden back in the day, before any of you were probably born. But she had picked up on the trigger point idea. She had made it more popular, and that piqued my interest on trying to get over this thing right here. So then when I had a lifestyle change and needed to pursue some sort of a money-making activity, that was also right in my consciousness. If you look back, it's really interesting, the history that shows up with stuff. And so as our tissues adjust to what we are demanding from them on every single day, some of them are going to get maybe twisted a little bit, or they're going to, a tube that's running through them is going to get pinched off so that you can't, it can't carry the blood, or it can't carry the lymph, or whatever. It's really, really hard to nail that specific little thing down, and it often is a collection of little things. That's where using your general full body approach with now an increased awareness of, all right, here are the ways I can shift and change what I'm doing that may create a different perception in for the person in general, or it might be sending a masking nervous system signal that overrides the sensation. That's called counter irritation. Or it can be enough of novel sensory experience that the whole body is perceiving sensation in a different way. That can be called, if it is masking pain, it can be called hyperstimulation analgesia. When those all happen just by applying a novel sensation into the system. And if you put it, so if you think smaller, like I'm going to put ice on a spot that's sore. I have a tendency to, when I'm working on the computer, to do this. So there's some compression on this part of my arm where my ulnar nerve runs through. And I know better, and I take it down and I prop it, and then pretty soon I'm like this, and I have a little pillow. But when I go to bed at night, any kind of rubbing across there irritates me. And so I often will go to bed with an ice pack on that. Not because it's even an inflammatory issue, because ice can help with that, but because of the counter irritation. I now feel the cold, and I don't feel that little picky ache that's in there. So, and it's very effective. So that's also a big player in what we do. The thing we've got to honor with that is that it wears off. It is temporary, but so is everything else, right? So if people can see that they can manage through the general massage, and you're able to just nuance what you're doing enough as you go through, all right? So I'm gonna clean up my dishes, and then, I've got a little extra time. I tell you, I got a little extra time, so I'm gonna get a toothbrush out, and I'm gonna work around my. Yes, I am filming. Do you want to come say hi? No. I'll take I got a minute or two. I'll take the toothbrush and apply a little bit more focal, on there.
Around the sink, huh?
And then I'll be real proud of myself. Because that part is better. I put some little focus on that. So that needed more pressure, and it needed some friction And then the other day I was emptying the trash, and it's in a container underneath the sink, and for some reason it caught my attention that the platform, the floor that it was sitting on under there was pretty grimy. And so I thought, I've got a rag right here that's got some bleach from something else I did. I might as well get after that now at the same time. It's going to get dirty again, you know, because that's just how life is. So we're not changing, when we look at this, we're not changing what a glide is. We're not changing what a need is. We're not changing what a friction is, and we're not changing what a joint movement is. You know, we're not changing any of those base tools. What we're trying to do is add in the knowledge of how this form is put together to see if we can keep it working really good, as well as it can. And when we find a little grime or a little stickiness or a spot that could use a little elbow grease or whatever, then we just slow down and embed that into the massage session. That even might be pretty intense, you know, so that might be on the hurt good range or something along those lines. But you have to sell massage as a maintenance system with that. And using housekeeping is a really good metaphor that people understand. So that's, you know, another metaphor that I will sometimes use is maintenance of a car or gardening and lawn care. People live that, they understand, okay, this isn't to fix it. It's going to change the state of it for a while, but without constant attention, that's going to come back up. Yeah, because you don't know what the underlying cause of it is. And then there's never any, rarely is there a single cause to anything. Sarah and I were talking earlier about a person that we mutually know that has a nerve in this area that is irritated. And of course, we're talking a little bit about nerve pain here. And it's driving her to distraction. Of course, when you've got something that's weird in one spot, you're going to get compensation in local and then more global. And so I had asked, I said, did she ever try a nerve block on it? And she said, yep, and it took away that narrow sensation, but now she feels everything else around it. So we do focus on what's the biggest or the most irritable. And that's where overriding or applying a novel sensation that is different enough and intense enough can really make a difference in the short term for people. So one of the main things we do is hyperstimulation analgesia in general. That's what we do. And people feel better for a while because of it. Okay, so the areas that we want to stimulate and the things that we want to change are the layers that Luke was talking about. So if we think from the skin in, we've got the skin proper, we got superficial fascia, we got a layer of deeper fascia that surrounds the muscles are in compartments, and then it gets down to where it's the bone. And in between the grooves of all these compartments, we've got tubes and nerves. So we've got blood vessels, lymphatic vessels, and we also have, they're called perforating vessels. It's like a roots on a tree that get into everything. You know, they come off of these big tubes and they scatter the fluid. You know, they take the fluid and so that the blood is throughout all of the muscle, just not just in the adjacent tube. And those are called capillaries. So that's when that happens. And then when in the interstitial space, where that's the space between the cells, it's like a suction system that picks up the fluid in there, and it gets into these little lymphatic angions or collectors, and then once it gets into that tube, it's called lymphatics. And so, you know, when we think about what do we do with water? How do we move water? You know, does it need a pump? Do we agitate it? Do we drain it by putting one end up higher than the other? Do we squeegee it? How do we do that in our world out here? How do we do that? So that's the fluid component, and then the surrounding enmeshing connective tissues like jello, and it can get thicker or thinner, and if it's thinner, it's more pliable, and if it's thicker, it's more stiff. It's a colloid, it's like gelatin. And I don't even think people make jello anymore, but we used to make jello all the time. And when I had the daycare center, I made finger jello. And does that make, you ever heard of finger jello? So you take the jello. So typically when you open up a thing of gelatin, put it in the bowl, you're supposed to put 1 cup of hot water, which is gonna help things dissolve. You're gonna make a solution. And then you put another cup. Now you can put another cup of hot water in there, but sometimes it'll say cold water. And you agitate it up and all of the crystals are absorbed, and that's actually, you know, this is where chemistry comes in and stuff. And then you put it into the cold, and it's still, and it goes from a liquid to a solid. Now, if I want it thicker, I reduce the amount of water, or I increase the collagen and other components in the connective tissue that are gonna make it stiffer. So Luke had you playing with some Play-Doh, and the more you manipulated it, the less stiff it became. And so that's a lot of what we're doing with this too, is just in general manipulating Play-Doh. It mimics in general the connective tissue network really good. Okay, so when we think about this, we have to think about, I have to have,
Do you want a sheet or anything?
no, skin, okay? Skin is relatively thin, and it is not the very, very top, but just under it. It is full of sensory nerves, just tons of them. And some of the research that has showed up is on these C-tactile fibers. They're some of the big ones that are, there's a lot of research on it. They're a little tiny, they're not big. They're a little tiny, but they're specific to pleasurable touch. But there's a way that you talk to those. It's the way you send the signal to those. You don't tickle. The tickle response is getting picked up by a different set of listening stations or sensory nerves, and that's protective. That was for if something was crawling on us or something. You know, we want that brushed off. So it's got to just dent the skin, and it's got to have a nice, consistent flow to it. But it's not gonna press down too much. But it's got to dent the skin just enough. Now, you're gonna miss those kind of when you lift the skin up, like what we're gonna teach you to do with a suction cup, for example. But that has its own thing that it does. So whether we are using a forearm on here, and with these C-tactile fibers, the broader the sensation, the better. This is gonna be more arousing, more attention getting than this, and this is even gonna be less than that. So, but we don't use a lot of pressure. There's not a lot of distortion, or there's not a lot of change, soft tissue deformation with that. People miss the importance of this particular level of massage. When you've been practicing, have you had somebody say that's too light? I want deeper pressure. I can understand that, but we don't want to sacrifice this layer to get down to this layer or this layer. And if we go too fast and just kind of plow in, we're missing a lot of information that the nervous system and bigger, the person that's part of that nervous system, the information they can give us. Also, there's a level of assessment called drag palpation, where you just come across the skin like that, and areas that might be a little warmer, which would indicate more activity, nervous system activity or blood activity, that they may stick a little bit. That's drag palpation. And instead of me going, is this where it's at? Is this where it's at? Is this where it's at? I can do that and it'll stick, and then I can apply the pressure and say, is that where it's at? You can feel hot and cold here. You can be just off the skin and feel hot and cold. It's not that there's any one thing that can cause the heat or cause the cold, but if it's different, if it's uniquely different than the surrounding tissue, then that should get your attention on why is that, or what's going on with that. All right.
So that's where not applying lotion or too much lotion to start is so important, so that you make sure you're actually contacting and picking up on how the skin feels.
So this pressure level is going to just dent the skin, but you're gonna be able to move across it, and you don't need any lotion to do that. If you go back and forth like this on that area, if there's an area that is hyperreactive, so this is a form of friction, it will get redder because it'll generate a histamine response. And a histamine response is histamine is vasodilator. So that's another way to notice. And in darker skin, you might have to pick it up with the heat. It gets a little bit more warmer, or it might get more purple color to it. Back and forth like this, but not this. That's going to irritate. So these things, when we work light, we got to make sure we're not irritating, just like we got to make sure that we're not poking and damaging tissue as we get deeper. Okay, as I go down through this skin is connected to, tightly bound to the superficial fascia. So it's not easy to separate the superficial fascia from the skin. And so I've got, this is kind of spongy here. If I stick some superficial fascia under it, what can I use to mimic superficial fascia? How about a paper towel? Okay, and these two are really stuck together, and I can't get, unless I do surgery, I can't get to the superficial fascia without also accessing the skin. I can't get to any of this without accessing the skin. So now I've got to think about how can I move this spongy kind of layer on the more dense layer underneath, which is the deep fascia, where it starts to wrap soft tissue structures, muscles into sausages. All right. What are you doing? Did you get me some superficial fascia?
I was getting some tape.
Oh.
Your skin.
So my skin is tightly bound.
Which part are you taping to what?
I'm taping this paper towel to that. So those are little filaments, actually. It's like Velcro. They're little Velcro-ish type things that connect the skin to the superficial fascia. Well done, Lugell and Fritz.
So.
Now you got a bind there.
Yeah.
That should be good. Okay, so when I'm working with the skin proper, I'm going to move across it. But when I'm trying to move the skin superficial fascia component on the deep fascia, I'm going to have a teeny little bit of an excursion, a little bit. So there's room here, but it's still anchored down. Where'd the tape go, Luke?
Oh, okay. I'll put it up there. Excursion meaning that it's going to move, it's going to travel some distance.
Yeah. But it anchors down, and one of the places that,
This to the foam.
yeah.
Yeah.
One of the places that the superficial fascia, which is the skin and that fluffy, spongy layer, sometimes it's very thin, like on your hand, and sometimes it's thicker. There's more depth to it. But it tends to come down and hold on at the joints. So if you were to put or on your sleeves right here, okay, there's a place that this loose joins on to the next part, and it's a firm connection. But there's still room for there to be a little bit of slide, right? So when we are thinking about the superficial fascial layer, we want it to move just that much, and in all distances. Now, if it moves like that, you've got a connective tissue problem. But in an equidistant area, you should get this little bit of translation, this slide. All right. So, in order to do that, I want my tissue in a little bit of slack. I don't want it really taut. And then my stroke is going to pull it from ease. So there's room. It's still hooked down, but there's room there. Whatever I'm going to do is going to take it so that it puts some tension into it. And what's happening under here is this is translating back and forth, or this way and that way. Hello, Logan.
Hi. So those fiber connections stay, but they're a little bit elastic, like little bungee cords. So like they'll get pulled and they'll stretch, but they should retract back to where they started.
So this little guy goes, if we can think of this as the skin, which is a thin layer, and then the superficial fascia, which is, it's because you've got, this is where a lot of our superficial fat is laid down. I call it the wetsuit. All right. What we're
Could be a
trying to,
marshmallow suit.
huh?
I'm joking.
Oh, can you come hold this? Right there. Okay, so he's stabilizing where the superficial fascia is gonna be, or the
Deep fascia.
the deep fascia that's gonna compartmentalize the muscles. And I'm gonna tell you, it's this interface between the skin, superficial fascia, and the deep fascia that causes most of the problems. People think it's muscle or whatever, but if I hold my sleeve down, superficial fascia, and try to move, the bind's not coming from muscle. My inability to move that up is coming from this first layer of tissue. Just like back here, if I bind that down, then, you know, now I'm stiff, now I can't move. It's not muscle layer, it's not the deep fascial layer. If it's anything, this interface has lost its ability to translate just a little bit. So he's stabilizing that, and what I'm gonna try to do with my methods is get this area to move right here. And that's not gonna do it, is it? That doesn't do it.
Better if I put it on the
Oh,
table.
on the table?
Well, you come over, you stay on that side. Where is it? Where is it?
All right, so
Both sides.
this kind of pressure that does address the skin isn't gonna address this interface. All right, so my method like this isn't gonna do it. Even if I come down with a deep pressure, is that causing that to move in there? It's more squishing it together, isn't it? So somehow I gotta be able to grab hold of this whole layer and translate it. Now it changed the shape of that, didn't it? So I can't slide, I gotta come down, get into it, and then I gotta bring it forward. And I've gotta do that from different directions.
And guess which of my hands is having to work hardest?
This one right here.
So this section where my left hand is getting pulled up a lot, right? There's a lot of tension and that's gonna embed down. So let's say this part is going down to other layers. So the table is like muscle layer and all of that. So it can really cause an actual.
Oh no! It's a wound!
Could be some translation.
And that's where people get confused about pressure. If this layer is bindy, people are gonna feel stiff. Just like if this is dense, people are gonna feel stiff. Then they're gonna assume it's a muscle. But that muscle layer's down here already. So our pressure has gotta be enough so we can engage this as a whole and then translate it. Another way we can do that is with a knead. You see that over there on how I can affect this low layer with but not this kind of a knead, which is what you see a lot. You gotta get down and you actually have to grab a hold of that whole layer and bring it around.
And now I feel it with both hands. Other principle could be, can you just change your glide? So here is that side, then I come around to the other side. Either I change their body or I change where I stand. I could be here and I wait until another position and then I'm here, or here to here. And just these angle shifts now suddenly have a more profound effect on this whole layer. And part of the cause can be maybe, let's say there was initially an injury or an overuse and muscle tone was part of it, but if the muscle tone changes, it changes this. This will get glued and will stick. So let's say the muscle did get a little bruise or got a little tear. It increases in tone for a while, it heals, but then this stays stiff. So it might have started somewhere else, but this will linger more than other stuff. But this getting stuck.
So another way, instead of coming at it diagonally like this, is I can position, I'm going to turn it up on the
Okay.
side.
Turn it this way.
Yeah. I can position this. Remember, this is the interface I'm trying to get to move. And I can come in and then that way. Or I can press into it and have them move the muscle back and forth and they can move it. But I've got to have enough pressure in to start to separate those layers or delineate those layers a little bit. All right.
Even the passive side of movement, I find some way to create the separation, and then if I'm moving the joint, then this is happening internally.
But if he doesn't stabilize here,
Then
you don't get the same effect. You might get some other effect, but you don't get the effect of getting the various layers to slide.
so it could be just like with this. We're visualizing that same mechanic. Like I could do it all here, but that being the only way to really create an effect on that tissue. Or I could shorten it using joint movement, apply a force into that tissue, and then change the whole region using joint movement. And that is still creating the same effect, if not a more replicated effect related to actual movement. It actually replicates how this would get stretched when a person moves their body if we incorporate the joint movement rather than us just.
Well, and there's a method, a named method, which I don't like it when they name methods, but they call it pin and stretch. So what happens when you pin something is that you bunch it up, find the area that you think is most stuck, or that you feel like where the bind is or whatever, bring pressure into that, and then when I bring this out, that's where the force is being translated, right in there. It's pretty intense, but it actually works pretty good.
It doesn't have to be at necessarily a lot of pressure. It can be at lighter or more. And the way things get labeled, there's another one, active release technique. Active release technique is just doing that by having a person do the active movement. So it's just, you position the same way, it's a pin and stretch, but instead of me moving the limb this way to create the stretch, I ask the person to actively move it. So I would pin here and say, okay, straighten your elbow, the client. It's just active movement versus passive movement. The intention would be, am I trying to affect the superficial fascia or am I going deeper? That's where the massage therapist mindset has to be. And you have various ways. You could do it more gently, but let's say the grime isn't going, like her analogy. All right, I start with just warm water and some paper towel. Well, that's not working, so then I get an actual scrub brush. And that's not working, so I get an actual scraper. You know, you can layer this in terms of intensity based on what you're perceiving. How does it respond? How does it feel? All of that.
So when we're thinking now about layers, and layers having a little bit of translation, and that the structure itself is stiff enough, but it's not concrete, right? You got to have a level of stiffness because stability comes before mobility. You have to have stiffness is what gives you your stability. And mobility comes, mobility happens at the joints primarily, but that is where you also, you have to have a level of slide in through there. And if it's too stiff, it's like having, this all bound up and you can't move it. So yeah, the joint proper itself can have issues in mobility, but it's usually the tissues or the layers around it that are restricting somehow.
That prior analogy is a good idea. Concept of clothing, something that's tailored to fit just right versus something that's way too tight and constrictive. That's usually what people get most annoyed by. But it also can be bad if something is overly baggy and loose. Like if something's hypermobile and too mobile, that is also a problem. More people will complain about the perception of something being too stiff, too restrictive. But we want it to be just right.
Yes.
Not everything needs to always be constantly looser.
And looser, certainly, like Luke just said, is not always better. We have a constant balance between stability and mobility. And if something is too loose, especially in a jointed area, the body will stiffen up around it. And if you try to make that more pliable or move a little bit more, you will get a rebound effect, because the underlying joint is too loose, and that usually happens in the ligament structure. There's a lot more focus these days on connective tissue disorders, and starting to see that is an underlying connective tissue laxity is an underlying issue in a lot of chronic pain and that sort of thing. And then we have to be very aware of that, because massage typically will make things looser and more pliable. We don't necessarily make things more stiff. So people can feel really good when they get off the massage table because they're all loose, but then they can't control, their ankles or something, and so they feel off balance. Or now then the head is not being kept where it's supposed to be, and then nerves get pinched as the head gets. All right, that's the soft tissue jello component. And you can't do that without also affecting the sensory mechanisms. You can't.